I'm Oliver Wiseman. I'm a consultant andrologist and I specialise in the treatment of male fertility problems at Bournemouth. So overall, there's a male-only factor in about 30% of infertile couples. In another 20%, there's a male factor as well as a female factor. So in 50% of couples, there's a significant male factor contributing to the fertility problems. Sperm is produced within the testicles. The testicles have only got two jobs. One is to make sperm, and the second is to make the male hormone testosterone. And unlike in the female, where all of the eggs are present at birth, in men, sperm are produced continuously. And so even a relatively short period of illness in a man can affect the sperm count subsequently for up to 3 months. When we look at a semen analysis, there are a number of factors which we're looking for. The first is what's the total volume of the ejaculate? And the second is what the acidity of the ejaculate is, because variations in the volume and variations in the pH or the acidity of the ejaculate can help to tell exactly what might be the problem behind the low sperm count. As well as looking at those, though, we're also looking at the overall sperm count. So how many millions of sperm are there per milliliter of ejaculate? Also, how well those sperm are moving. How many sperm should look normal? And those are the things which give us an idea of the healthiness of the sperm. So from the point of view of causes of poor sperm count, there can be medical problems which the male is suffering from. They can be problems with production of hormones, which can affect the testicles' ability to make sperm. But more commonly, there can be a structural abnormality actually within the scrotum. And one of the commonest things which we would see is a big dilated bag of veins around the testicle, and can be present in up to 40% of men who have fertility problems. And that's called a varicocele. We know that repair of the varicocele can then lead to an improvement in the sperm count. If we find no sperm in the ejaculate, then what we need to do is try and work out whether the problem is one of there being a blockage, such as, for instance, a man who's had a vasectomy before, or a patient who has cystic fibrosis, or whether the problem is a problem of production and a non-obstructive azoospermia. They may have had a history of, for instance, undescended testicles of the child, or of a torsion or a twist of the testicle. Or maybe they will have had some cancer treatment, chemotherapy, or something like that. And then also lifestyle factors can affect the sperm count. One of the commonest things which we see now is patients who have a high BMI, and that can significantly affect the sperm count. Because what happens is sperm need high levels of testosterone, which is the hormone that's produced within the testicle, and that helps to support sperm manufacture. And that testosterone can be converted by fatty tissue into the female hormone estrogen. And so not only are the testosterone counts then lower in men who have obesity, but also the estrogen levels are higher, and sperm don't do well with higher estrogen levels. But other factors which are important to consider are also healthy eating, so trying to avoid processed foods, takeaway foods, and trying to have more fruit and vegetables, avoiding saunas and hot baths, which have the effect of heating up the testicles and which can also affect sperm production. Moderate exercise is important. So for moderate, we're talking about half an hour to an hour, maybe 3 or 4 times a week. I'm not talking about 4 or 5 hours on a bicycle, which probably wouldn't be good. So there are a wide range of things which men can do to try and improve their sperm count themselves, but it's also important that they are assessed if they have a low sperm count by a specialist to make sure there's nothing more serious and nothing operatively, so surgically, that we could do to improve the sperm count. So making sure that all of those reversible factors are optimized, I think, is really important before going down the route of IVF. Because even if it doesn't improve the sperm count to a level whereby the couple can conceive naturally, it's likely to lead to better quality of sperm, which can then be used for IVF and is more likely to make the IVF successful.